Welcome to The Happy Doc. My name is Taylor Brana. In this podcast and related website, thehappydoc.com, the goals are to inspire, develop knowledge, and provide tools to enhance your creativity, joy, and success as a health professional. Our guests provide their stories, tips, mindset, and much more, which have allowed them to succeed in such a demanding field. Our next guest is Dr. Lisa Splittstoesser, an internal medicine specialist on the island of Kauai in Hawaii. She utilizes integrative lifestyle-based medicine in her clinical care, and she owns her own clinic. She's truly happy being able to work in a way that is congruent with her values as a doctor and a human being. She sees patients for up to an hour and a half, yes, an hour and a half, and she spends almost complete FaceTime with them. She has created a welcoming environment for her and her patients to not only get treated, but even more importantly, to heal. Listen to this inspirational happy doctor describe her journey, her views on challenging the healthcare system, and much more. I want to apologize in advance for some of the background noise in the audio, and I'll need to figure out how to edit it for now, but the content is great, and Dr. Lisa is a true inspiration again, and I hope you enjoy the episode. Okay, welcome everyone. This is another episode of The Happy Doc. Today, I am extremely excited to introduce Dr. Lisa, who practices in Hawaii. So without further ado, Lisa, can you introduce yourself?
Sure. My name is Lisa Splittstoesser. I am an internal medicine physician practicing on the island of Kauai. I'm not sure how much background you want me to give, or
No, give as much as you'd like.
I practice integrative, holistic medicine, lifestyle medicine, functional medicine. There's lots of names for it. Basically, I, in a nutshell, just try to be present with my patient, listen to them, and help them help them find their path to well-being. That's probably in a nutshell what I try to do the most.
Great. And that's something that I think is very much needed in today's society. So how did you kind of come about to discover integrative medicine, or, feel that was kind of your path?
So I would say, this journey started decades ago, although I didn't know it at the time. Mm-hmm. I would say from a pretty young age, in adolescence, I felt that I was taught through what I saw my parents go through that we have control over the destiny of our health. My father, by the age of 30, was already experiencing angina. He was markedly overweight. He was a smoker, and his doctors told him that you're going to be dead in the next several years if you don't do something. His father had died around 50 of a massive heart attack. Wow. So he had pretty bad genes to begin with, and he was not living a good life. And I don't know if this is exactly what spurred him to make change, but he moved the family from Philadelphia to the middle of the South Pacific on a little island in Micronesia. And the first year that we moved out there, he started running. And by the time we returned to Philadelphia the following summer to visit family, and this is all hearsay because I was only a year old. Of course, I don't remember. But we went back the following summer a year later, and he had lost so much weight, his mother didn't recognize him. Wow. And he never had another episode of angina, never experienced any heart problems, and died still walking the day he died, he was still working. He was walking 5 miles a day, and lived a good life. And then my mom took her a little while longer to get on a good path, but my mom was diagnosed with diabetes in her late 40s, early 50s, and again was markedly overweight and not living a healthy lifestyle. And I saw her also transform through dietary changes, get off of, and when she was diagnosed with diabetes, it wasn't subtle. She had blood sugars in the 600s. She was on an insulin drip. It was bad. And I saw her change her life and get off of all her medications. So these kinds of things, even before I was a pre-med student, these were kind of things that I was already kind of had an inkling. And so in adolescence, I was always into fitness. I wouldn't say I ate the best, but I always kind of knew, okay, I got to take care of myself. And then, through my path of loving science and humanities, went to medical school. I was actually a history major in college, if you can believe that, and went to medical school. And that was because I had kind of dual passions of humanities and the sciences, and kind of I felt like medicine could combine those two. But what I thought they could combine the two. But what I actually experienced in medical school and residency was disappointing. The way we're trained, it really left out the humane or the humanity part that I thought that medicine would include, meaning relationships with patients and really forming connections. And I think intuitively I must have known that, even though I was not an unhappy medical student, I was not an unhappy resident. I did all the work and I loved learning. But I think over the years, I slowly came to come back to this other part that I was really missing, that humane part of medicine. I felt like I was kind of like a trained soldier. We were trained, here's the person's problems or complaints. You come up with a list of a differential diagnosis. You hone in on a diagnosis and you give typically some type of treatment, which most of the time included a pill or a surgery or something like that. And over the years, I was like, I just could tell from my years of experience doing this type of medicine that my patients weren't getting better. They weren't getting healthier. It wasn't fulfilling to me at all. And I sensed that for the most part, even if my patients didn't outright say it, they weren't happy with this type of care. And, and I seriously considered getting out of medicine. And then some other life events kind of propelled me. My husband had a very serious dive accident where he came close to losing his life, couldn't walk, had to learn to walk again. And it really made me, that was kind of the tipping point. It was at that moment that it made me stop and really think about, what am I doing? Can I do this type of medicine for the next 30 years? I knew I wasn't passionate about it. And I'm someone, when I'm passionate about something, it just takes hold and I am such a happier person. And that's kind of what started me on my path. And I remember a few months after my husband's dive accident, I sat down with the book, The Power of Now by Eckhart Tolle. I don't know if you're familiar with it.
I'm not.
And it really, just like the title says, The Power of Now, it really brought me into the present moment. Wow. And it really started me. That was one of many things, along with the practice of yoga, mindfulness meditation, that really started me on the path to finding something I was passionate about. And then through a series of various events, a much older physician on Kauai kind of took me under his wings and introduced me to this whole field of integrative medicine, where I realized I was not alone, because I was feeling very lonely. I felt like, am I the only doctor that doesn't feel like what we're doing is right? Is it me? Is it just me? I was thinking maybe I'm just unhappy and therefore that's why this isn't working for me. And maybe I should just get out of medicine. And lo and behold, this whole world opened up to me where I found hundreds, if not thousands of doctors that felt exactly the way I did, that the way we were trained, to some extent has its good parts. If someone comes in having a massive heart attack or a car accident, the type of medicine that we learn can be life-saving and can be fundamental and needed in those situations. But for the majority of what we take care of on a day-to-day basis, it doesn't work, or that's how I felt. And I found a whole tribe of doctors that felt exactly the same way, and were doing things differently. And that's, I feel like I kind of put myself, and I'm still putting myself through my own second residency. And so here I am. I think, it was not, I'm saying this in a very short period of time. It probably took me about 5 minutes to summarize this, but this is something that happened over, 6 or 7 years.
Right.
And it happened slowly, this passion that opened up. And I stayed in my treadmill job. I guess most of the unhappy docs would call them a treadmill. I stayed in that job for probably 3 or 4 years, still kind of doing what I didn't truly believe in, but slowly making changes even within the system, taking longer appointment times, not allowing the clinic to double book me, just and overtime and even kind of transforming a little bit of my office space and making it more inviting. So I made changes. And then at a certain point, there were many things that happened that I realized I can't stay in the system.
Right.
I need, in order to grow as a holistic physician and really truly continue to follow my passion, I had to leave. And that was the scariest leap I've ever made. It was much scarier than getting married, having a child. It was scary to put myself out there and to say I'm leaving because I can't do what I don't believe in anymore. It was extremely scary, and it's still a little scary, but at this point it's been 2.5 years, and I look back and I have no regrets. I love what I do.
That's awesome.
Yeah.
Yeah. So just to summarize briefly, first off is, just to take in everything you said, you've come a long way. You went through this training kind of in a sense, a cognitive dissonance when you take in your, family upbringing and seeing all of these lifestyle changes. And then you go into medicine and you're not really seeing that being utilized. And then finally you found this, integrative practice that kind of brought it all together for you. So you currently have your own practice now?
I do. So I have a very small private practice that I love. I fell into this place. That older physician I told you that kind of took me under his wings, he was actually practicing in this clinic and was kind of getting ready to retire. And so this place kind of opened up, and that's when I said there was a lot of things that kind of came into alignment that I knew it was time to leave the old system.
Right.
So I practice in this wonderful, it's actually an old plantation style house, Hawaii, that has been transformed into a clinic. And so I'm one of the practitioners there, but we have a naturopathic physician there. We have an acupuncturist who practices traditional Chinese medicine. We have 2 midwives, a psychologist, a physical therapist, someone who does muscle testing, several massage therapists. So we have a variety of different practitioners who utilize this little house clinic where I practice.
Wow.
I have to say, the thing that I love about it, it's just such a wonderful environment to be in.
Right.
To go to work every day and just to love where I'm at. And I was able to create what I had envisioned at my old clinic, a very healing environment, where my patients come. And, I just love the feel of, the room where I see my patients. You know, it's got the original old hardwood floors of the plantation house and built-in bookshelves. And I was able to, you know, put my own touch on it. And I have 2 big comfortable chairs that my patient and I sit in. And I really feel that's a big part of the patient encounter is the patient should feel welcomed and feel comfortable. And, it doesn't have to be fancy, but they should still feel like, wow, this is a place where I can heal.
Right.
And that's what I really tried to create.
That's amazing. And like, so for you, first off, it's kind of sounds like the transition into like your own practice, it was kind of this nice gradual falling into it, so to speak,
Yes.
where things sort of lined up, which, you know, that is like amazing that it kind of worked in that way. I'm sure that any listening physician would obviously love for that to be the case of things kind of just like falling in and, you know, having those options opened. Did you feel like at any point you sort of had to do a little bit of risk taking, or there was kind of some searching going on, or was it really just this kind of beautiful process for you that kind of aligned perfectly?
Oh no, it was definitely huge risk taking. You know, financially, psychologically.
Yeah.
Because,
can you explain
you know,
that?
when
Yeah.
you're, well, psychologically, I would say, you know, you've been through medical school, so,
Sure.
you know, we're ingrained, I think, the way we're taught, it's like, this is the only way things are done. You know, this is the way medicine is practiced, and there's no looking outside the box. And so getting past that and just being able to say, no, that's not what I believe. I believe we need to look outside the box. Sometimes the answers are inside the box, but a lot of times they're not. And so psychologically distancing myself from the way I was trained was hard. It was really hard. And to, to leave my colleagues, and it was very hard to explain to my colleagues, you know, because if they didn't have any, and most of them had no inkling about integrative medicine or functional medicine or anything, so it was hard to explain.
Right.
So that was the psychological. I mean that, and that. I mean I have to say it tore me, you know, and it was, it was scary, and it was, frightening. You know, I've had talks with Sydney about kind of that trauma, you know, of leaving and being able to say goodbye. I kind of, I compare it to, like, you know, maybe a battered wife leaving her husband, or, you know, something where you're just, you know that it's the right thing to do, but at the same time, oh my God, it's just so hard.
Sure. So you sought out support to kind of talk through this kind of form of trauma as well from the psychological aspect. And how about, so another thing here is, you know, the financial aspect, which I think is really important, you know, for physicians that are seeking, you know, other options. How did you kind of overcome that with yourself, and what were you thinking in your head, and how did you take action?
Well, I have to say I was naive, and
Okay.
I was at a point where I just knew for my life I had to leave, and I kind of leapt with not all my ducks in a row.
Okay.
I don't regret it, but I definitely took some financial risks, things with my husband's business that we thought would pull us through during the time I made the transition didn't. So, you know, I've incurred some debt.
Sure.
And, but again, I don't regret it. I also took a big pay cut, and I had to make changes in my life in order to be able to financially survive.
Sure.
But it has all been worth it. Things like, okay, I don't have a new car. My daughter doesn't go to private school anymore.
Okay.
These are things that I had to make decisions about, for, thinking about me, thinking about my family.
Sure.
So it's been I wouldn't say financially difficult, because I find the more and more I practice this type of medicine, and maybe it's just my overall change in life, the less I need and the less material things that are important to me.
Right.
And so even though I've had to make these, I guess some people would call them sacrifices.
Yeah.
I don't even feel like they're sacrifices. I just feel like, okay, this is what I'm meant to do. I work, even though, I do make a lot less money than I did, but I also work a lot less. And I am so much more at peace with myself and with everything I'm doing. There's no price tag for that,
Right,
and I think,
right.
I think some physicians out there, that's going to be really important. How do I continue to make that bottom line? I don't have the answers for that, unfortunately. Some docs probably do. I don't. And some of that may be, getting into kind of the nitty gritty. I decided to stay within the insurance world. So some of that plays a role. And
Sure.
I have my reasons for that. But yes, it definitely, financially, it's kind of changed the dynamics, of my life and family. But again, I still think, you can't put a price tag on it. I think the things that my daughter is learning from watching me go through this are invaluable, and hopefully will set her up to make better decisions in life.
Yeah, absolutely. I completely agree with that. And, speaking as a child from that perspective, I would be so proud of my parent for going for what they love over money. And I think that's a really important lesson. I'm going to do a kind of funny test right now, or question.
Okay.
Pain scale, 0 to 10, 0 being the least amount of pain you've ever experienced, 10 being the most severe amount of pain. What would your pain scale be for before you transitioned?
Are you talking about
Specifically how, quality of life? How was your quality of life? Was it severe, 10 being horrible pain or horrible quality of life, 0 being the most amazing quality of life?
I would say maybe a 3 or a 4. So I would say, thinking about what I've said over the last, half hour or so, however long we've been talking.
Sure.
I make changes kind of slowly, and
Okay.
in general, I'm very optimistic. So like I said, I was never an unhappy med student or resident, or even the clinic I was practicing in. I didn't feel unhappy,
Sure.
like I didn't feel like I was in pain. I felt like I was being held back from living
okay.
I felt like I was being held back. That's a good word, from practicing the true type of medicine I was passionate about. So,
Sure.
I definitely, I think I was very lucky. I did not have administrators like breathing down my throat.
Sure.
I told you, I even in that 3 to 4 years when I was making the transition and was still at the old type of clinic, as I started seeing less and less patients, my administrators were not coming to me and saying, Lisa, why are you seeing less and less patients? And
Right.
but I was, so it wasn't, it wasn't that painful. But in retrospect, now knowing where I am now, whereas, did you say 0 was the worst or 10 was the worst?
10 was the worst.
10 was the worst.
Yeah, sure.
So I would say I'm now at a 0, whereas I was at a 3 or 4 before.
Right. So definitely improvement. And, that's important to hear too. It's not necessarily to say that, as much as like we can paint the picture that everything is horrible, it's not to say that everything is horrible. It's just that, and you're kind of saying it's that we're not, if we go through this process and you feel inside yourself that something's not quite right, and it's not the quality of life or the, image that you went into medical school going with, and now all of a sudden, you're living a life that's not congruent with your values and who you are as a person, then all of a sudden, you feel held back like you were. So it's just amazing to kind of see these examples of people who aren't held back anymore. And another thing I wanted to comment on was you mentioning this kind of idea of transitioning slowly, but also the ability that you're able to kind of find your way, and then your quality of life, which is so much more important than the money aspect. Mm-hmm. And that's really important. I mean, the fact that you're literally at a zero, that you're happy and that your quality of life is improving, and then you realize you don't need things anymore. And that's really important too, because people, especially in this field, are justifying the difficulty of their work instead of just choosing to be happy. And I'm not saying that, I have all the answers, and I'm not saying that anyone I interview has all the answers, but, we have to choose to be happy at some point and choose to fight for what we believe in.
Mm-hmm. And I talk to my patients every day about this, because it's not just doctors.
Right.
I mean, my patients who are in all walks of life, from people working as a cashier at Walmart to, PhDs at the University of Hawaii. If you are not happy in your work, your health is not, there's going to be problems with your health. And so, I talk to them almost on a daily basis. I'm dealing with many patients who are not happy in their work, and it is affecting their health.
Yeah, absolutely. I think when we're not happy, it's like this almost like internal incongruency, and that just causes, a lot of issues, like stress and lack of sleep and, all of those other effects. So that makes complete sense. So Lisa, I was going to ask you, just kind of digging into some questions here. What qualifies as happiness to you? What do you think that is?
Oh,
I know it's a kind of a broad topic, but
I would say a big part of happiness for me is a sense of peace, within me, but also a sense of peace within the people around me. Connection. I think that's for me a big part of it also, is being able to feel connected to those around us, because I see so many people that are surrounded by a lot of people, but not necessarily connected, and they're unhappy. And I feel the more sincere connections we make in life, the better we make the world around us, and that could be, connections from, little things, someone, something like, when I drive through the little town to get to my clinic, we only have one main road in Kauai, and it can get a little congested, and people are trying to make left-hand turns. And a lot of times, if there's a lot of traffic, it's hard to make a left-hand turn. No one's stopping. And I always make a point stopping and letting people through. And that little connection as the person waves and is like, thank you, thank you for stopping. Little connections like that, to deep connections that I have with my patients, to extremely deep connections I have with my family. I think that, to me, brings me a sense of happiness. And what I hope for is, as all of us make more and more connections, the world becomes a better place.
Yeah, definitely. So you're kind of talking about almost like when you have the chance to give your little point of joy, so to speak, and to offer, yourself to someone else. That's really how you make your world, and strengthen the connections around you.
Yes.
Yeah, and that's a really beautiful concept. And coming from the East, well, I'm not from the East Coast originally, but being in the East Coast, I'm sure my Team Philadelphians could definitely listen to that right now. Yeah, definitely, like, especially thinking about the New York attitude. But anyways, I digress. Going on to the next question, if you were to talk to younger Lisa, let's say 10 years back, or even further, what would you tell yourself? What advice would you give to a younger student, or yourself, and really could launch you forward and improve yourself more quickly?
I saw this question that you had written up for me, and I was thinking about this, and I have to say, Taylor, I don't think I would tell the younger Lisa anything, because I think I got to the point on my journey where I'm at because of everything I went through, and I might not be where I'm at if I had changed things. And I think there's a reason life is a journey and we go through these things. And so that's my personal opinion. I wouldn't change anything. I definitely think there's reasons that I went to, for example, medical school instead of maybe naturopathic school, or, I don't think I would be in the same place. I think there is a reason all these things happen to me. So I don't think I would want to go in a time machine and tell myself to do something differently 20 years ago. I think I needed to take all these steps to get where I'm at now.
Yeah, and that's a great answer. And I also think, not everyone is, after hearing that response, not everyone's ready to make huge changes, and we all have to kind of work on ourselves in the ways we are ready for. So yeah, I mean, that's a beautiful response. So, yeah. What is the structure of your current practice? And I know you said you work with a lot of practitioners, but, kind of what's your daily schedule? Like, how much do you charge? Kind of just getting into a little bit of the business aspects for anyone who would be interested.
So, I work in the clinic 4 days a week, and I see on average about 8 to 10 patients a day. I limit my new patients because I typically on average spend an hour to an hour and a half with a new patient, and my follow-up appointments are typically around 30, sometimes up to 45 minutes, sometimes longer, but on average. And so most of what I'm doing, not all, but most of what I'm doing is counseling. A lot of counseling regarding nutrition and activity and sleep. And stress reduction. So I'm, with my new patients, with my follow-ups, that's a lot of what I'm doing. Because I am a primary care doctor, I do some kind of urgent care stuff, colds and things like that, but that's a minimal part of my practice. Unfortunately, I don't charge. I told you I'm still within the insurance world, so I'm at their beck and call. So
yes.
I don't charge. I receive what they think I should get for, what I'm doing.
Right.
So I don't have charges. I contract with, the insurance companies, and I give them a code, and depending on which insurance company, they tell me, well, this is what you deserve for this, and so on and so forth. I'm still in that world.
Yeah.
I probably, I would say what I love about my practice is the majority of the time I work, it's truly face to face with patients. Everybody has paperwork and things like that. There's no way you can be completely devoid of that.
Yes.
But because I see so few patients compared to what I did 5 or 6 years ago, the paperwork is a lot less because I'm seeing less patients.
Right.
What I love is really, I talked about the connection and how important that is to me. And so to me, the biggest asset is spending time with your patients. Your patients want to be heard, and that takes time. There's just no way around it. You can't take shortcuts. You just can't.
Yeah.
And I really allow myself and my patients the time that they need. And sometimes they don't need that much time. Sometimes they need a lot of time. And so you just never know what's going to walk in the door.
Yeah, absolutely.
Does that answer your question?
Oh, absolutely. Yes. Yeah, it definitely does. And the fact that, yes, you're saying you're taking insurance, you have spent a tremendous amount more time with these patients. It's kind of incredible that you're, able to, kind of sustain yourself while doing that. And, obviously you discussed the ways that you've kind of limited certain aspects of your life to be able to do that, but you felt like that hasn't really limited yourself. So
yeah, and some of in terms of kind of just the business aspect of it, one thing I would say to practitioners that are thinking about doing something like this, the more you do on your own, and Pamela, emphasizes this, the more you do yourself, the less overhead you have, the more money that's in your pocket. So for example, I only have one employee. She's an LPN, although she does more administration than nursing type things, but she's kind of my right-hand woman, and she has helped me build this practice, and I wouldn't be where I'm at without her. But I do a lot of things myself. I decided after about 3 or 4 months in practice to take over my own billing. So I do my own billing. I answer the phone a lot. I make appointments. I do my own, I don't do all my own faxes, but if there's something to be faxed, I fax it,
Right.
So I do a lot myself. One of the things I love is when I answer the phone and I say, "Good morning, Kauai. This is Dr. Lisa Splittstoesser." And on the other hand, on the other side of the phone is one of my patients, and I can see their jaw dropping, and they're like, "Dr. Lisa, are you answering your own phone?" And I just love that. Or even better yet, like when an insurance company calls or a lab calls, and the person on the other side is like, "This is the doctor?"
Yeah.
So,
usually they have to jump through hoops to get in contact with doctors.
Right. And in reality, people say, "God, you're answering your own phone." It actually, to me, it saves time, because in my old clinic, what would happen is we had a call center. The call center would pass on the note to my nurse, and then the nurse would pass on the note to me, and then I would have to call the patient back. Because
the message would kind of get,
Yeah, and think about all that wasted time. And not to mention how angry it makes a patient, because even though I tried at my old clinic to make timely phone calls back, it might actually take me a day to get that message.
Yeah, exactly.
So...
And going down that chain, the message might have been messed up, and then you're getting two different messages when you could have just gotten it directly. Yeah, that's pretty like all over the place. So that's really incredible. That's a great tip. The fact that, doing more for yourself and taking real charge allows you to lower the overhead. That's a great tip for people to hear. And you had referenced Pamela Weibel, who has been a great mentor for myself and also for many physicians, and that is another great resource of someone that people can check out. With that kind of being on the topic, what resources have you utilized, or books? I know you discussed The Power of Now. You mentioned Pamela Weibel. Are there any other resources or books or mentors that you think people should kind of take a listen to or look at to kind of gain inspiration?
Oh, I have so many.
Sure.
I would say probably one of the first mentors, really, like in the integrative medicine world, is a lady, Dr. Mimi Garnieri, who is an integrative cardiologist. And she wrote a beautiful book called The Heart Speaks. And it was her journey from conventional interventional cardiology in the early 1990s when stents were first coming out, and her journey into integrative cardiology. I was fortunate enough that she owns a home on Kauai. And,
oh, wow.
And the older physician gentleman that, like I said, took me under his wing had met her, and I was actually able to sit down with her on several occasions here on Kauai and really get a firsthand, look into this integrative medicine world. And she's pretty well known nationally and internationally. She's actually the president of the Academy of Integrative Health and Medicine.
Wow.
And like I said, I was just lucky enough that she happens to own a home here on Kauai that I was actually able to have like one-on-one experience with her. But her book is wonderful. It's somewhat about her journey, but then it's also a lot of patient vignettes over the years. So that was one of the big things. God, I have so many. Another big one was a book by Dr. Saki Santarelli, who works alongside with Dr. John Kabat-Zinn at University of Massachusetts, and they developed mindfulness-based stress reduction, MBSR. And he wrote a wonderful book called Heal Thyself, Lessons of Mindfulness in Medicine. And I think that book, along with The Power of Now, really propelled me into the importance of being present with my patient. So when I walked into the room, I wasn't thinking about the lab tests I had to follow up on or the patient in the hospital. I left everything outside the room. When I went into the room, it was just me and the patient, and I was giving them my 100% undivided attention.
Wow.
And that was one of the powerful messages that I got from Dr. Santarelli's book. And it's a wonderful book for physicians and any healthcare provider that's really working on healing themselves, truly. Because I'm kind of digressing, but I would say that any practitioner that wants to be truly happy in their practice, they have to heal themselves first. You can't do it without healing yourself. If you want to heal others, you have to heal yourself first. And it's not to say that I'm totally healed, but you have to go down that path and that journey before you can really be able to touch other people's lives. That's my personal opinion.
I mean, I really like your opinion. I completely agree. I think where the unfortunate part is, I think we have this collection of very broken people trying to heal broken people.
Yes.
And, you know, until that's one of the reasons I'm trying to kind of raise this platform of kind of the healthy people leading broken people and healing them, because then that, you know, that has a stronger, it's more powerful when you have these healthy people or people who have been broken and hurt and have healed themselves to speak about healing, because it's more believable. It's a stronger approach. You know,
it's interesting. I just yesterday watched a lecture on the placebo effect. You know, the lecture talked about a lot of the scientific research behind the placebo effect. And part of the lecture talked about how when a physician talks to the patient about a certain type of whether it's a medication or some other type of therapy to lead themselves to health, the more the practitioner believes it, the more the patient responds. And like I said, it could be true of a placebo pill, a pharmaceutical, physical therapy they recommend. If the physician or the healthcare practitioner recommending this to the patient believes it, the patient does better.
Interesting.
So, and a lot of that is, it's the placebo effect. So it's that the patient sees how truthful the practitioner is when they really believe in a therapy, and it makes the therapy work better.
Wow. That's like really, that's a phenomenal concept. I'll have to sit with that one. That's great. Let me ask you, did you have any more resources you wanted to share, by the way, or?
Oh, God. I mean, I could go on and on.
Okay, so how about after this interview, if you wanted to, just send me a list,
I would say,
I can...
I would say a couple other books and then some big organizations. So,
sure.
There is a wonderful book called Buddha's Brain by Dr. Rick Hansen, who's a psychologist, who really he talks about the science behind why things like meditation and other stress reduction activities actually change the brain and how it helps heal. I have a lot of my patients read that book. And I think it's a wonderful resource both for patients and clinicians. I have a lot of other books I recommend, but I think those three that I mentioned are pretty paramount. And then two big organizations, if practitioners are looking for ways to educate themselves about integrative medicine in general. The Academy of Integrative Health and Medicine, which I mentioned earlier, is a wonderful resource. They have conferences every year. They have online CME that you can do. And they're a great resource. They actually now offer a fellowship in integrative medicine for practicing physicians. So you don't have to quit your job to do the fellowship. It's actually mostly online, and you can do it while you're practicing.
Wow.
So it's designed in a way to allow doctors to stay within their practice and do a fellowship. And then the other big organization that I think is phenomenal is the Institute for Functional Medicine. Again, they offer wonderful resources in terms of continuing education. And these two organizations, for me, it's all about looking outside the box. You know, if it's not working, how else, what are other ways we have of answering these problems that patients come to us with, that, you know, they've gone to 10 or 15 or 20 different doctors and they're not getting better. How do we look outside the box to help these patients?
Right. And you're also talking about the fact that, you know, these are just extra tools in your toolbox that you can utilize when, you know, as you said, like the standard care and the standard treatments aren't necessarily working. So yes. That's phenomenal. I'm definitely going to have to add that into the website so that, you know, students and physicians can see all of this.
And these are, you know, those two organizations I mentioned are not limited to medical doctors and medical residents and medical students. I mean, there are chiropractors, naturopaths, nutritionists,
right.
nurses, I mean, all different types of healthcare practitioners that are utilizing this type of education.
Great. Yeah. So really it's anyone who is interested just in general outside of just the medical, you know, Western medicine world can utilize it. So that's awesome.
Yeah, and that I just to make a little side note about that, you know, about integrative medicine. The term integrative, that's such a big part of it. And I don't really like labels, but that the idea that we collaborate and integrate with different types of healing practices, to me, is so important. I think when we are trained, like I said, we're kind of stuck in a box, and we're not taught to incorporate these other types of healing practices, which for some people are so imperative to them truly finding their vitality, their health. And when we shut them down and say, oh, that won't work, or we don't acknowledge their ability to heal, I think that takes away so much from the patient's ability to heal. And that's a huge part of what I try to do and other integrative practitioners try to do, is be able to collaborate and accept that a patient is seeing an acupuncturist and how that can be incorporated into their road to healing.
Right. Yes. And if we're going to comment on the placebo effect you discussed earlier, by not acknowledging that they have the possibility to heal, you're just giving them less of a chance to heal.
Exactly. Exactly. So I think it's important for physicians that are interested in this type of field, you need to educate yourself. Because I have to say, mine, you know, before I started down this journey, I was very ignorant of what a naturopathic physician was, or what an acupuncturist did. And so you really have to educate yourself in order to understand what these practitioners are doing and start believing, okay, they have the ability to heal. And I've seen it firsthand, you know, over the years, because I have a lot of patients gravitate towards me because they know that I'm open to accepting other types of practitioners. And so I hear their stories of how this type of practitioner helped me, you know, in my healing process.
Yeah, that's amazing. And that's something we're not exposed to in medical school, is the other sides of things. Or if it is mentioned, it's very brief in nature. And, you know, a lot of people would just say, oh, the studies aren't there to prove X, Y, and Z, you know, so.
And that's the thing. There are lots of studies. I mean, so that's why MDs cannot ignore this anymore. There is a lot of scientific research behind these other types of practices. And that's one of the things that I've learned. And being, number one, being open to it, but then again, like I said, educating yourself that this is not voodoo medicine. This is substantial medicine. This is substantial healing practices that has scientific research behind it to prove that these therapies work.
Well, great. Yeah. And I am very happy that you're an advocate and you have educated yourself, because, I'm personally not exposed to this side very often. And we're just kind of inundated with the typical medical studies, that kind of are proponents of the pure pharmacologic treatments. So it's just, it's good to have, multiple perspectives on health and healing. So, with that being said, a great, question here would be, how would you personally improve medical culture? What do you think we can do differently?
Oh, wow.
Yeah, that itself could be a very long discussion, but just kind of ideas of what could we change?
Wow. I definitely have a lot of strong opinions about this.
Sure, I want them.
But, to me, I think the reason that when I say we, MDs, have gotten into the place that we're in, where a lot of us are unhappy with the type of job we have and the insurance companies, is we've allowed it to happen. We have not stood up for what we feel is right. I think as a group, we need to start fighting back. And I don't, we can't take on insurance companies and things like that. But what we can do is one practitioner at a time, like me and you and other doctors, really establishing clinics and practices that I think are truly promoting health and healing rather than treating disease. There's a beautiful cartoon that I remember Dr. Mimi Garnieri. I watched her lecture, and one of the slides she has, which just kind of emphasized how what we're doing is not working. It's a picture of there's a faucet on in a big sink, and the water is overflowing, and there are two people trying to mop up the water. And okay. It's like, if we don't turn off the faucet, there's no way we're ever going to be able to mop up all this water. The water being all the chronic disease and everything that we see, rather than getting to the root of the cause, turning off the faucet so that we can actually get ahead of the game. Right. And hopefully the more practitioners recognize that and start saying, no, I'm not going to spend 5 minutes with a patient because there's no way I can get to the root of the cause in 5 minutes. The more we put our foot down and say, this is not the right way to practice medicine, the more and more we do this, the more the tides turn. But I think it really has to start with the doctors standing up and saying, this is not right. Right. This is not the right way to practice.
Yeah. And just to comment, I think some people get kind of bogged down by the idea of, how do I change the system? How do I change this big thing that is so, far away from me? Well, I think, and you've kind of alluded to it, is first work on yourself and free up yourself. And then that gives you the opportunity to kind of liberate and help and open the minds of others. But if you haven't done that yourself and you haven't healed your broken self, then you don't even have the ability to do that yet. So if anyone's feeling like, oh, how do I fix this huge thing? I mean, what I realized was I need to fix myself. Mm-hmm. And then as soon as I did that and I started working on myself, that gave me the opportunities and the ability to create, this podcast and create this website and spread the word of, bringing positivity into the culture and, being more loving and kind of expressing ourselves in this open way. So I completely agree. With that being said, I think I'm pretty much done with the questions for today. I wanted to give you the opportunity to speak of anything else that you wanted to add, if that was an option for you. If not, we can close out. And yeah.
I would just say I would emphasize how wonderful this whole journey has been in really now, you used a term, I can't remember exactly what it was, but I try to think of, I'm practicing in alignment with my core values.
Congruency, maybe?
Yes. Yeah, congruency. And I find that ability to be able to do that is phenomenal. And I think, over the last few years, as my practice has evolved, because it didn't start off perfect and it's still not perfect and it's evolving, but that ability to be able to do that, to truly feel like I am in alignment with what I believe, and am passionate about what I do, has had just phenomenal effects on me. I believe and I hope on me, on my family, on my patients, and I will continue to do it because I don't see any other way to do it. Yeah, definitely. And I think what's been happening is we've allowed the system, so to speak, to remove our congruency. And what we, when everyone came in with this idealism, the idealism was this image and this visual and this person we wanted to be. And each step of the way, it starts to remove you from that person or that image. And the real question is not, how do I keep moving forward in the system? The real question is, how do I get back to that image? Right. And that's where I think we can really, find happiness. And, you're saying that as well. So it's just really great to hear someone who's actively doing it. That's so much, that message. I'm going to placebo everyone listening. I'm going to placebo you guys. That it's so much more powerful in the fact that, Dr. Lisa is doing it. She went from feeling, at a 4, which isn't horrible, but she's automatically already a happy person. And she's now a 0 and she's congruent with her values. And that's so powerful. And you can do it too. The journey is not going to be the same. The journey is going to be very different for every person, but the possibility is the same. Mm-hmm. So I think that's a great, message for us to close out with. So thank you so much, Dr. Lisa. I sincerely appreciate it. You're very welcome. Bye, Taylor.
And there you have it, folks. That's the end of the episode for today. If you want to check out any more material, go to www.thehappydoc.com. Also, if you'd like to provide feedback, ask any questions, please comment on the blog posts or send an email to thehappydoc1@gmail.com. Thank you so much for listening in, and I hope you have a great week. Take care.